Good afternoon, everyone. Today I'm here to update you on COVID-19 in our province. I saw a message recently that read, it shouldn't have to happen to you for it to matter to you. Well, fellow Albertans, this is where we find ourselves today. I know we had all hoped that we would be out of this by now, but we are still in the midst of a third wave. Thankfully, our case numbers have stabilized and our transmission is slowing down, but we still have a ways to go yet. This isn't unique to Alberta. All of Canada and much of the world has seen a surge driven by variants. I know there are still naysayers and skeptics out there, people who don't believe COVID-19 is a threat or who think that we never should have had any public health restrictions to begin with. Some say the case numbers are inflated or exaggerated. That stretched hospital capacity, they say, is some kind of a myth. But as we've seen here at home and around the world, COVID-19 is a very real situation that we're all facing together. And I've always believed that when presented with the facts, people overwhelmingly will do the right thing to protect themselves and their fellow Albertans, especially the most vulnerable. That's why today I've invited Dr. Hinshaw, our Chief Medical Officer of Health, and Dr. Verna Yu, CEO of Alberta Health Services, to present the facts about COVID-19 in our province right now and how it's affecting our hospital capacity. This is proven scientific information that is based on health expertise in Canada and around the world. First, let me say once again that nobody wants restrictions in place, and everyone wants this pandemic over as soon as possible. I know it's easy to look to the U.S. and wonder why we're not in the same place. Of course, the U.S. is much further ahead of Canada in terms of widespread immunity with their vaccine program, but that has also come that the higher levels of immunity were also because of higher levels of infection, and that came at a steep price. Overall, about 1 in 3 Americans have had COVID-19 versus 1 in 10 here. Most U.S. states have had 3 to 5 times the death toll as Alberta. So to those who criticize the measures that we have put in place, I would just say that Alberta has done everything that it can to protect human life while minimizing the negative effect of restrictions, and we will continue to pursue that balanced path. Behind every number and statistic about COVID patients hospitalized are people who are ill and in some cases deathly ill. In addition, behind each of these people is a team of dedicated healthcare workers who are forging ahead and doing their best to save each life despite months and months of stressful work, long hours, and often deep exhaustion. I would challenge each of us to take a moment to consider the human effort and the human toll behind these numbers. There are more than 22,000 active cases in the province now. Our positivity rate is sitting at 9.6%. There are 647 Albertans in hospitals with COVID-19 right now. And we talk a lot about capacity in our healthcare system, but this is what it looks like right now. Of those that are in hospital, 186 of them are in intensive care. These 186 Albertans are critically ill with COVID-19, and that's a record high for the pandemic in Alberta. Many of these are people who are sedated because they're on respirators, unable to breathe on their own, and who cannot have any human contact except through layers of PPE. Of course, throughout this whole time, Albertans have continued to suffer strokes, heart attacks, serious accidents, and sudden health issues that also require admittance to intensive care. Currently, added to the 186 COVID patients in ICUs are about 55 more people who are in ICUs for non-COVID-19 reasons, but who are also fighting for their lives. So that's a total of 241 people in intensive care, when normally our healthcare system is set up to care for about 170 people in ICU. So we're about over 40% above our normal maximum capacity and our pre-COVID record high for ICU admissions. That is why we say that the measures we have introduced were necessary, and because we must protect our healthcare system. Combining large numbers of COVID cases in hospital with and ICU, with everyone else who also needs care, puts everyone who needs healthcare in jeopardy. And when AHS takes steps to free up capacity, that means that thousands of people who need surgery are told to wait. Eventually, if we did not take action, we would have to start looking at canceling even thousands more surgeries and triaging more patients. That means denying some people care, making a difficult decision on who gets intensive care, for example. I can't imagine that there's a single person out there who wants to test out this scenario. We are relying on evidence and on facts to plan for the days ahead because these numbers just don't lie. There's also been a belief that COVID-19 is a big city problem and not a rural one. But this couldn't be further from the truth. Throughout the pandemic, people living in rural areas of the province have been more likely to be hospitalized with COVID-19 than people living in large urban areas. Since February of this year, hospitalization rates are 26% higher, and ICU rates are 30% higher in rural areas than in urban ones. Right now, several of the regions that are showing the highest rates of COVID-19 per capita are outside the bigger cities. Some of these areas are reporting rates higher than Calgary, and in some cases, rates that are 2 times higher than Edmonton. So this is the point here, isn't no one's to blame for COVID, and no region is. The point is simply this is not an urban versus rural issue. It's clear that COVID-19 is everywhere in the province, and people's lives matter just as much no matter where they live, where they come from. This information is on our website, and it's updated every day. I'd encourage every Albertan who wants to see what's happening in their local community to go take a look. All of this said, there is one tried and true way that we can stop COVID-19, and that's through vaccinations. We often forget that vaccines have saved millions and millions of lives over the past century, helping to eradicate or virtually eradicate deadly and debilitating diseases like polio, smallpox, chickenpox, and measles. We're seeing that in real time in our own province on COVID-19. The people that are getting ill and hospitalized now are overall younger and without compromising health conditions because we took steps to protect the most vulnerable and elderly Albertans first. That strategy has worked. Now we just need to get everyone else vaccinated. And we are now getting steady supply for vaccines. We've just made sure that everyone who wants a vaccine can get it as quickly as possible. 2.2 million doses have now been administered, meaning 49% of Albertans of the age of 12 and older have now received at least one dose. We may cross the 50% threshold later today or tomorrow. We have also made sure that Albertans have many options to choose from to get their dose. In addition to the many AHS clinics like the one in Edmonton where I got my vaccination, there are close to 1,400 pharmacies who have now joined the effort to protect Albertans, and many doctors' offices as well. As I mentioned before and continue to say, vaccines are our way to get back to normal. We've seen real-world proof of this in the United Kingdom, in Israel, the United States, and other places. We can do the same here in Alberta. And I would ask all Albertans to join in the effort to get family, friends, and loved ones protected so that we can all get back to normal. If they don't know where or how to get their dose, help them make an appointment close to them. Keep talking about getting protected, what it means to you, and what you hope for after this pandemic. And in the interest of continuing to be as clear as possible about the current COVID-19 picture, today we are launching an online map that will break down vaccination rates by geographic area. Soon, you'll be able to look up the percentage of individuals who have received at least one dose, the percentage of people fully immunized, and the total doses that have been administered in your area by age group. Make the choice to get protected. The sooner you are, the sooner we can lift restrictions and get back to normal. So here is some really good news. Albertans have stepped up to the plate in the last couple of weeks in a big way. Thanks to the efforts and sacrifices made by millions of Albertans, we now see case numbers coming down quickly in almost all parts of the province. We do expect to see hospitalizations peak in the next week or two because of the time lag effect between infection and hospitalization. But with declining COVID numbers, we can look forward to easing restrictions in the fairly near future. We are working on a clear path to reopen Alberta this summer, tied in part to the rate of vaccination as well as to hospitalizations. It'll be a careful plan that will get us to a great Alberta summer as long as Albertans continue the huge momentum to get vaccinated. Last week, the Calgary Stampede announced that they plan to host a scaled-back Stampede this year. That's great news. But how big a Stampede it will be, how many of us can visit and celebrate the greatest outdoor show on earth, all of that depends on how many of us stick it to COVID by getting a vaccine. So please do your part by following the public health measures for just a little while longer and getting vaccinated as soon as you can so that all of us can get back to normal and enjoy a truly great Alberta summer. Until then, stay safe, keep abiding by those measures, as I said, until we get through the other side together. Thank you, and now I'll invite Drs. Hinshaw and Yu to provide their remarks.
Good afternoon. I would like to start by sharing my condolences with everyone who's lost a family member or loved one during COVID-19 over the past 15 months. These are our friends, our families, and our loved ones. As an Albertan and as a healthcare worker, my heart goes out to everyone impacted by this pandemic. I'd also like to take this moment to thank everybody who's been working in the healthcare system. I'm incredibly proud of all the physicians, healthcare workers, and with the care and the support that they provided to Albertans throughout these past 15 months, from our frontline hospital teams, to our paramedics, to our community teams, to our public health staff and inspectors. We all owe you a huge debt of gratitude. I would also like to thank Albertans for doing their part to take care of one another and for coming together to try and end this pandemic as fast as possible. Today, I would like to provide you with an update on the demand on our healthcare system, as well as steps that we continue to take to ensure everyone who needs hospital care will receive it. Throughout the pandemic, AHS has responded to the health needs of Albertans, ensuring that people can get the care that they need. We responded to the ebbs and flows of demand, including the need for testing and contact tracing, the pressure on our acute care and ICU beds, and now to our efforts to get as many Albertans immunized as quickly as possible. We've had to be nimble, constantly adjusting how we provide care so that we can focus place on priority areas. This was true during the first and second waves and is certainly true now. Our healthcare system is under significant stress, more than at any point during the pandemic. In fact, we are currently experiencing several record highs across the healthcare system. I'll share with you some numbers which help paint a picture of just how busy our hospitals are right now. We now have the highest number of COVID-positive patients in ICU at 186. For context, this is 6 times higher than the record number of influenza patients needing ICU care in previous years. We currently have more than 240 people in our general systems ICUs across the province, including those who have tested positive for COVID-19. That is easily the most ICU patients that we have ever seen in our healthcare system, and definitely higher than what we've seen in waves 1 and 2. Over the past month, the number of people with COVID needing ICU care has increased by more than 100%. Overall ICU capacity across Alberta would be above 140% if we had not opened an additional 106 beds on top of our pre-pandemic ICU capacity at about 170 beds across the zones. We also now have the highest number of patients on ventilators at 222, of which more than half are COVID-19 patients. Our ICU teams are providing incredible life-saving care to those patients, but it's important to keep in mind that they've been doing this for more than 15 months through 3 significant waves. They are understandably tired, and we should all take pause to appreciate the work that they're doing. We know that COVID cases in hospital tends to lag about 2 weeks behind the trend of cases in the community, so we can expect cases in our hospitals to continue to increase for a little while yet. The threat of serious illness is real. We are seeing more people needing ICU care, particularly younger adults with fewer underlying problems. We have taken several steps to strengthen our healthcare system in areas of greatest demand. For example, as I mentioned, we added additional acute care and ICU beds in many of our larger hospitals. For example, in Edmonton, we have opened an additional 54 ICU beds, in Calgary an additional 40 ICU beds, and in Central Zone and North Zone, 6 additional beds each zone. We currently have adequate capacity to provide ICU care to those who need it. We are carefully monitoring demand and are concerned at the rapid increase in more serious cases. We do have the capacity to increase to a total of 425 ICU beds provincially by opening additional unstaffed beds, by repurposing other clinical areas such as isolation rooms or operating recovery rooms to act as ICUs. This is similar to what we did in first and second waves and is something we hope that we do not need to use. Our biggest current challenge, though, is staffing these additional spaces. And this is certainly more difficult than the first and second waves. And as mentioned, our physicians and staff are understandably exhausted. We are fortunate, however, to have a single provincialized healthcare system, which means that we have a broad staffing base that we can draw from. We also have a highly skilled workforce. For us to be able to redeploy staff to ICU, so we've had to reduce our scheduled surgical activity in some communities by up to 30%. This has a significant impact on those Albertans who are waiting for non-urgent scheduled surgery, and we're continuing to do our best to complete as many procedures as possible. And we are continuing to do urgent, emergent, and cancer surgeries. This is an example of how COVID-19 has impacted all of us, and not just those with COVID-19. Another benefit of our provincialized healthcare system is that we're able to balance pressure and demand across all of our zones. For example, as a result of the very high case rates in Fort McMurray and in other North Zone communities, some North Zone patients are now being cared for in Edmonton hospitals. Since May the 9th, 14 patients requiring ICU cases have been transferred from the North Zone to Edmonton hospitals due to capacity pressures. This includes 5 transfers from Fort McMurray, 3 from Lac La Biche, 3 from Cold Lake, and 3 from the communities of Grand Prairie, Edson, and St. Paul. 12 of the 14 patients were COVID-19 positive. All of the 14 transfers were related to hospital capacity pressures due to the COVID-19 pandemic response. This is not unusual, though, but has been exacerbated by COVID-19. For context, in February and March, when COVID-19 case numbers were relatively low, An average of 3 ICU patients a week were transferred from the North Zone to Edmonton. And while patient transfers are safe and always based on clinical need, they have an obvious impact on those patients and their loved ones. Every effort is made to ensure that patients are supported if they need to be transported to a different facility. In addition to increasing beds, reducing surgeries, and transferring patients, we have contingency measures in place to add capacity should we need it. Pandemic response units, such as the Butterdome site in Edmonton, have been created to support additional inpatient capacity if required. As well as the Butterdome site and the Sprung structure at the Peter Lougheed Hospital in Calgary, we are constructing pandemic response units in shelved space at the K Edmonton Clinic in Edmonton and at the South Health Campus in Calgary. These care spaces are going to be kept in reserve as part of our responsible contingency planning, and they are currently not needed. But they are a good example of how we have been able to respond in unique ways to demand caused by the pandemic. This work is part of our ongoing proactive pandemic response planning and is one of the several initiatives that will ensure that our healthcare system can meet increased demand caused by COVID-19. We hope to never have to use these units. If we can stop the spike, reduce the number of positive cases in the community, and in turn reduce the number of patients needing hospital care, these units will never be needed. Of course, one significant weapon that we have to fight COVID to help reduce the pressure on the hospital systems are vaccinations. We have seen how vaccinations have played a huge role in protecting our seniors, and now we're looking forward to seeing a similar trend with the general population. I'm heartened to see so many Albertans say yes to the COVID-19 vaccines. So thank you to all Albertans for playing a part in protecting themselves, their friends, and their loved ones. I'm also extremely proud of our AHS teams involved in the provincial vaccination rollout. They have helped Albertans with grace and kindness, helping to build a wall of defense against this illness. So thank you for the opportunity to share this update, and I hope that all Albertans stay well and stay safe.
Thank you, Dr. Yu, and good afternoon, everyone. Before I begin, I want to provide an update on an adjustment to our COVID-19 protocols currently in place. Based on feedback and discussion of relative risks of different activities, we will be amending current restrictions to allow drive-in events to take place, effective today. Anyone attending these events must attend only with members of their household in the same vehicle or 2 close contacts for those who live alone. Turning to my update, we will be posting our usual daily numbers online later this afternoon. While I usually share high-level figures and we post detailed data online, I know it can sometimes be hard to put all the pieces together. We're all suffering from information overload, and after 14 months, there is a lot of misinformation circulating out there. Today, I want to look at what the data says about some common myths around COVID-19. It will be a little numbers heavy, but sometimes the details matter. Though I don't often use slides, I will be using them today to help illustrate the information. One question I often get is whether COVID-19 is only spreading in urban areas, and if it's true that you're at lower risk if you live outside a major city. In fact, 12 of the 15 areas with the highest active case rates are not large cities. Most of the areas with the highest active case rates are in rural locations. As we see in this slide, COVID-19 remains a threat to the entire province. Right now, there are 66 areas with an active case rate of 300 per 100,000 or more. About half of those areas have an active case rate of 500 per 100,000 or greater. Some of these areas, such as Lac La Biche County, Chestermere, Airdrie, Lacombe, and Whitecourt, are reporting rates higher than Calgary. In some, rates are double those in Edmonton. Now, I know people will say that's because the population size is smaller, which is true, but using rates actually is the best way to compare transmission risks in different places in an apples-to-apples kind of way. The bottom line is that right now, you are at a higher risk of being exposed to COVID-19 in many rural parts of our province than if you were living in a big city. The second myth is that this is somehow new and that people in rural areas have traditionally not been at risk. While it is correct that some areas have had lower case rates at the beginning of the pandemic, that has clearly changed. Also, case rates are not the only factor to consider. It is also important to look at the rates of severe outcomes, like hospitalizations, if people get sick. As the Premier noted, our data shows that over the course of the pandemic, people living in rural areas have been more likely to be hospitalized with COVID-19 compared to people living in urban areas. Since the beginning of May, the North and Central zones have had higher hospitalization rates per capita compared to any other region of the province. The North Zone in particular has had hospitalization rates more than double those of Edmonton, Calgary, or South Zones. Among cases diagnosed since February 2021, the case to hospitalization ratio is 26% higher for rural areas of Alberta than for urban ones. This means if they contract COVID-19, people living in rural Alberta are 26% more likely to end up in hospital compared to those living in an urban location. Similarly, the case to ICU ratio is 30% higher. Out of the 647 hospitalizations reported yesterday, 225 of them live in rural areas, which is 19% higher than would be expected based on population alone. Similarly, there are 66 patients with COVID-19 in ICU right now who don't live in one of the major urban centres. This is 22% higher than we would expect based on their share of the population alone. None of this is to stigmatize rural Albertans or to suggest that any one part of our province is to blame. This is not an urban versus rural issue. It is clear that COVID-19 is spreading and having an impact everywhere in our province. This virus doesn't care where we live or what we believe. Anyone and everyone is a potential target for infection. The next myth I'd like to address is around testing. There have been ongoing questions raised about whether PCR, or polymerase chain reaction, is the best technology to diagnose COVID-19 and determine if a patient is infectious. PCR testing has been used for many years and is very specific, faster than older methods of identifying infectious agents such as viral culture, and can identify infectious illness early in the course of disease. PCR is routinely used to identify the influenza virus and other respiratory viruses, as well as new germs like Zika virus and Ebola, and many other infectious agents. The PCR test that we use has been confirmed to be highly specific for SARS-CoV-2, the virus that causes COVID-19. It does not react to other viruses, even other coronaviruses. Studies have shown the PCR test is over 90% accurate in detecting the virus that causes COVID-19 in people at the very beginning of their illness. Testing before symptoms start can detect about 50% of cases for those who are incubating the illness, with better accuracy in the day or two just before symptoms begin. There's been a lot of talk about false positives, but our lab has evaluated the risk of false positives by testing samples known to be negative for COVID-19 and found that they are extremely rare. The test techniques used in our laboratories have been validated against national standards and are under continuous quality assurance, so we can rely on these results. It is true that some people can continue to test positive for several weeks after they have been infected, as their body sheds dead virus. However, this is exactly why we do not require a negative test before ending isolation, and why we focus on testing at the start of symptoms and early after exposures have happened, to minimize the impact that this prolonged shedding could have. PCR tests continue to be the gold standard across Canada and around the world, and we will continue to use them in Alberta as a highly effective virus-fighting tool. The results of these tests reinforce my earlier point that COVID-19 is a province-wide problem right now. Our positivity rates by health zone, seen on this graph, which is the percent of positive cases over all tests that are done, show us that every area of Alberta is struggling to contain this virus. Right now, Alberta's average positivity rate for the last 7 days is 10.7%. That is near the highest point it has ever been in this pandemic, and rates in every zone have been increasing over the past several months. We are starting to see the beginning of the impact of new public health measures. In the last week, positivity rates have remained stable or even decreased slightly in many zones, unfortunately except for North Zone. As you can see in this graph, the North Zone's rate is considerably higher than all other zones, and it continues to grow. Next, I want to express my concern about the fact that I continue to hear some people question whether COVID-19 poses a serious health threat to anyone besides the very elderly and those with certain medical conditions. No matter someone's age, their medical condition, or where they live or work, every life is important and valued. This is not up for debate. In addition, although the risk of death is significantly higher in some groups, especially those over the age of 80, COVID-19 continues to negatively impact healthy young adults as well. When you look at severe outcomes, 40% of those who have been hospitalized since the beginning of February have been under the age of 50, including 12% who are below the age of 30. Similarly, 32% of those who have been admitted to the ICU since February 1st have been under the age of 50, with 7% under the age of 30. While hospitalizations and deaths are, of course, the most tragic outcome from the virus, there are other serious, long-lasting impacts that thousands of Albertans face after surviving the virus, including prolonged illness, sometimes called long COVID syndrome. It could be years before the long-term impacts are fully understood. Experts need time to study the experiences of people after infection to see how and if COVID can cause long-lasting complications as individuals age. I know this is a lot of information, but we can and must continue to take this virus seriously. As was said last year, we do not have to fear COVID-19, but we must respect it. I urge Albertans to be thoughtful and appropriately critical of what you see on any social media or other platform. Take a moment to assess the accuracy and consider the source of any information that you read before you believe it or pass it along. Look for information from a reputable source, which ideally can be confirmed by multiple other reputable sources. By doing so, you will help stop the spread of misinformation and help keep us all safer. Thank you, and we're happy to take questions.
Okay, we'll now go to the phones for questions. We'll do 2 questions each, either 2 off the top or 1 question and 1 follow-up. Operator, can you please put through our first caller?
Our first question is from Jackie Wilson with Global. Go ahead, Jackie.
Good afternoon. This one can be for the Premier or for Dr. Hinshaw. There are outbreaks in over 80 child care facilities and preschools across Alberta right now, with 15 more added to the provincial outbreak list on Friday. So why is this spike happening, and what is being done to stop it?
I'll refer that to Dr. Hinshaw.
Thank you for the question. We are watching the numbers of cases in those childcare facilities. It's important to remember that we are very proactive when it comes to outbreaks in certain locations, childcare facilities, long-term care centers, schools, and acute care centers. They receive a significant focus because of the importance of protecting those in those particular facilities and making sure that transmission is stopped. So some of that reporting, again, is based on the very close monitoring that we do in those locations. We have seen that variant cases, when introduced into childcare facilities, particularly the P1 variant cases, when those are introduced, they can spread more easily than we have seen even with the B117 or other variant cases. And we are currently working with our teams to determine if there's any additional interventions that need to happen in these facilities. It's important to remember that we have a lower threshold for reporting outbreaks in these facilities than in some other locations. And so while the number of outbreaks is high, that doesn't necessarily mean that each outbreak has a large number of cases. And again, we are very cautious when we are implementing quarantine measures for those who might have been in close contact. We are, of course, encouraging all those who work in these locations to access the immunization that they're now eligible for and have been for several weeks. And again, wanting to make sure that we are looking to see if there are any patterns or trends that can help us understand if there are additional measures that need to be put in place in these locations.
Jackie, do you have a follow-up?
No, thank you.
Operator, can you please put through our next caller?
Next is Don Braid with the Calgary Herald. Go ahead, Don.
Saskatchewan, as you know, has a very specific reopening plan. They tie it to 70% of first vaccinations. That's already been announced that measures will take effect on, I believe, June the 1st as a consequence of reaching that. And also, there's the whole idea of creating an incentive for people to get vaccinated, and that's one. I just wonder how close you are to a reopening plan. You've mentioned it today, and also about that added incentive of a reopening based on vaccination rates.
Great questions, Don. Thank you. The answer is we are very close to releasing our plan. We'll be discussing it later this week at our Emergency Management Cabinet Committee and then again early next week. So I would say stay tuned for the near future for us to outline a similar plan. One thing that's significantly different is that this third spike has hit Alberta much harder than Saskatchewan. So I believe our total active cases per capita are almost twice of what they are in Saskatchewan. So we can't go quite as quickly as they have. And our hospitalizations per capita are also a fair bit higher than they are in our neighboring province. So we'll have to proceed with a little bit more caution than they are able to in Saskatchewan because we got hit harder on this third wave, and that has had an impact, obviously, in our hospital capacity. But we will certainly be tying relaxation in large part to vaccine, excuse me, let me restate that. I think I misstated that. We will certainly be tying reopening in large part to the percentage of population that gets vaccinated. We'll also be looking at hospitalizations at least early in the reopening phase, in the reopening plan. But you're absolutely right. We need that kind of skeptical, that vaccine cautious share of the population to realize that their ticket to freedom and their way back to normal lies through getting vaccinated. The good news is this: I think we're going to hit 50% of the eligible population with at least a first dose today or tomorrow. We have 1.2 million doses that are scheduled to arrive over the next 4 weeks. I believe we have 800,000 appointments in the system. So the numbers are moving fast, and we should be getting into some very high numbers in terms of share of the population vaccinated next month. So, Don, just wait. I think potentially next week we'll be coming out with a plan. And again, the percentage of population vaccinated will play a large role in it.
Do you have a follow-up, Don?
Yes, your heavy emphasis today on rural-urban and noting that rural infections are actually more serious. I can't help tying that slightly to what happened last week with your very own caucus, where a lot of people from rural Alberta in your caucus seem to be much more skeptical and maybe not even aware of these figures. Why have you done that specifically today, and does it have any link to your concerns about let's say, UCP politics in rural Alberta?
No, this is not about politics, Don. This is about transparency and public information. We've heard from a number of municipal councils, mayors, reeves, and councillors in rural Alberta, the view that their communities are being somehow penalized for the pandemic that is, they claim largely a urban issue. And so we're trying to make sure that people are informed. We're trying to protect all Albertans while also minimizing the negative impact of restrictions wherever they live. We have taken a regional approach, as you know. Those areas, those local geographic areas with very low levels of transmission have not been affected by the most recent round of public health restrictions. But our message here is simply this, that COVID is everywhere. We all have to be careful. And as far as I'm concerned, doesn't matter where you live, your life is invaluable and we must take reasonable measures to protect lives wherever people happen to live. So it's just important. I think we've seen a growing kind of commentary coming from some folks in rural Alberta who've believed that measures are inappropriate for their areas. And our point is simply that if you look at the map that Dr. Hinshaw showed you, it's actually many of those areas that are creating disproportionate challenge and pressure on the healthcare system. In fact, in Edmonton, we have far more people with COVID in hospitals and ICU in Edmonton than we do in Calgary, even though Edmonton has much lower case numbers. And the reason for that is, as Dr. Yu said, so many folks from the north zone and smaller communities that have had to be transferred into Edmonton because they ran out of capacity in their local hospitals. We just want people to be aware of that.
Operator, can you please put through our next caller?
Next is James Keller with the Globe and Mail. Go ahead, James.
Hi there, this is a question for the Premier. You said in a radio interview last week that you hadn't learned the vote breakdown when caucus decided the fate of those 2 MLAs who were expelled. Do you know the vote results now, and how did you vote?
So, James, the answer is that no, I don't know the breakdown. The meeting was chaired by Nick Milliken, who MLA for Calgary Varsity, who is the Assistant Deputy Speaker of the Legislature, very good with procedure, and is a lawyer. And he conducted the vote. He confirmed every member's vote with them directly and confidentially, and did not share that information with anybody, myself included, nor anybody on my staff. And my vote was a secret vote. It's a matter of caucus confidentiality. That was one of the issues that has raised concerns internally, so I'm not going to breach that confidentiality.
James, do you have a follow-up?
Yeah, there's 15 other MLAs who signed that letter last week. One of them, Dave Hansen, said he applauded Todd Lowen's decision to step down as caucus chair and call for your resignation, and he applauded his courage. So, what is the buy-in in your caucus right now for, a set of policies that you've just outlined today in, really stark life and death terms?
Well, I truly believe that the vast majority of our caucus understands the gravity of the situation with this pandemic and the need to take serious action to protect lives. And I think our caucus is broadly united on that. I think some people have wanted a more regionalized approach. They've given expression to that, and in fact that's reflected in policy. As I've said, with areas with very low levels of transmission not having been impacted by the most recent round of public health restrictions. From the beginning, James, I've been clear that there is a debate in our society about the best way to respond to the pandemic, and that debate exists in the government caucus. Unsurprisingly, I've always welcomed expression of views, but they have to be articulated in a responsible way. And at the end of the day, we are a team, and there has to be respect for that team. There has to be a minimal level of caucus solidarity and mutual loyalty. And I think that was behind the decision that was made last week.
Operator, can you please put through our next caller?
Next is Bill Fortier with CTV News. Go ahead, Bill.
Pardon me, the question is for Dr. Hinshaw. Premier Kenney may also want to comment, though. And there were a lot of numbers there, so forgive me if you sort of touched on this. But I understand what I heard was that rural Albertans right now are 26% more likely to be hospitalized, and that info is coming soon in terms of maps or whatever on immunization. The question is, are you seeing right now a tie to things looking worse as far as case numbers in rural areas and a lack of uptake on vaccines? Like, are the vaccine rates lower in rural areas than they are in the cities right now?
So one thing I want to make clear is that the difference in severe outcomes is from all data starting in February, where there were, unfortunately, again, just given where we were in our rollout, we didn't necessarily have a significant amount of vaccine at that point. So it would not be expected that that difference would have been due to vaccines in the earlier part of the data that I referenced. So the impact, again, of that rural-urban difference in severity is unlikely to be entirely caused by vaccines. We do see some difference in rural-urban uptake, but again, that's not universal. There are some rural areas that have very high coverage, and we are looking right now at the specific geographic coverage levels in order to determine how best to make sure that everyone across the province has good access to vaccine, and whether or not in some particular areas where there are lower rates, whether we need to focus a bit of additional attention there. And again, that's not uniquely in rural areas. It really depends on the characteristics of those specific locations.
Do you have a follow-up, Bill?
Yeah, just a quick follow-up.
Sorry to interrupt there. Yeah, if you look at we've done a breakdown based on local geographic area and the take up on the vaccine program, and it's pretty spotty. You'll see that there are some pockets in urban which are a fair bit below the average level of vaccination, and there's some spots in rural that are. And as Dr. Hinshaw says, we're trying to figure out what lies behind that. How can we help those folks get the information they need, or perhaps just make it more convenient to get the vaccines?
Thanks, Premier. Bill, your follow-up?
Just a quick one. Can you specifically tell me right now, of eligible people, is the North Zone rate lower than, say, Calgary, Edmonton, Central? Is North Zone, are fewer people who are eligible getting the vaccine in the North Zone?
I believe that is the case. I haven't looked at the data for the last week, but that was the case a week ago when I last saw it. And if I could just ask our folks to get the most recent data to you so you can actually see the numbers on that.
Operator, can you please put through our next caller?
Next is Aaron Collins. Actually, I'm sorry, it appears Aaron has left the queue. Our next is Robert Tuttle with Bloomberg News. Go ahead, Robert.
Yes, hi, this is for Dr. Hinshaw and the Premier. As you've mentioned, in the North Zone, especially in Fort McMurray, Lac La Biche, and Wood Buffalo, the cases are not just going down but going higher. I'm wondering to what extent the turnarounds in the oil sands are contributing to this, and whether companies should perhaps make other plans or delay this work that they're doing right now.
Well, I'll take the first stab at that and then refer to Dr. Hinshaw. I know a number of the oil sands operators did delay their planned spring turnaround. I know that, for example, Suncor has postponed most of their turnaround activity from March until June. To quote Mark Little, he told me that they were making a multi-million-dollar bet on that working out. And that is to say that the vaccine coverage will make it much safer and easier to operate in June. I think that was a prudent call on the part of that company. So I think other companies have made some rescheduling of their turnaround efforts. But there is no doubt that with the surge in staff numbers that comes with a turnaround, including from people traveling, I mean, we do know that we got a lot of the P1 variant circulating in the Wood Buffalo region that likely came in with, in part with workers traveling in, fly-in, fly-out workers. And so that has had some kind of an impact. But I do know that Alberta Health Services have been working very closely with the oil sands operators and with the camp operators to do everything possible, including rolling out rapid testing there. We are going to be helping them with on-site vaccination programs, but also in ensuring that there's rigid compliance with the public health restrictions. So there's been a lot of cooperation. And Dr. Hinshaw, would you like to add anything to that?
Just to echo the hard work being done at the municipality level, at the level of all of those oil camps, the First Nations and Métis communities in the area, as well as Alberta Health Services to turn things around. A lot of different interventions are underway. I would say that the last data that I saw about the cases in Fort McMurray in particular, it was the vast minority that had links directly to oil sands or to those work camps. So there were some, but it did not constitute the majority of cases in that location. So again, I think it's a multitude of different causes. And again, I know that there's a lot of work being done on the ground to turn things around. And I just want to commend all those who are involved in that work.
And if I could just offer a little statistical precision here, courtesy of Vince, the reporter at the Fort McMurray Today newspaper. When we report numbers for the Fort McMurray Wood Buffalo local geographic area, it doesn't actually include most of the oil field camps, most of the oil sands camps, because Dr. Hinshaw can explain the rationale for why they're separated. So if you want to drill down in terms of the data here, we can have folks at Alberta Health share a little bit more precise picture of where exactly the spread is happening up there.
And do you have a follow-up, Robert?
I guess then why is it spreading so rapidly up there? Why is it expanding? And when you have a rollout of extra vaccine and everything, it just seems a bit puzzling that it's gotten worse.
Well, it's true that we did accelerate the vaccine supply for the region and lower the age eligibility threshold significantly versus the rest of the province. But that really started about 3 weeks ago. And as you know, these vaccines take a couple of weeks to show their full effectiveness. And I don't think they're anywhere close to what we would call herd immunity in the region yet. But Doctor, do you have any other hypotheses to answer that question?
No, just to reiterate that the cases that we're seeing today are the product of exposures that happened 1 to 2 weeks ago. So we wouldn't expect, again, to see immediate results from the interventions that are in place. However, over the coming weeks, again, we'd expect to see the results of all of the different interventions, including immunization, as well as some of the other things that have been put in place in that community to show up in reducing rates in the near future.
All right, we have time for 2 more questions. Operator, can you please put through our next caller?
This is Andrew Lawton with True North. Go ahead, Andrew.
Good afternoon, Premier. As we see the conflict in Israel and Gaza mounting, a few of your UCP MLAs have put out statements condemning what they say are human rights abuses against Palestinians. One in particular, MLA Mickey Amory, said in a Facebook comment that he is, as an MLA, calling for the federal government to intervene in this conflict, and he takes aim at violence he says Israel is perpetrating against Palestinians. Is this speaking for the UCP? Is this speaking for you, this statement?
No, and I believe it's only one MLA who has made that comment. Andrew, as you know, provinces do not have foreign policies. Canada has only one foreign policy. My views about that conflict are very well known from my 2 decades in the federal parliament and my 10 years in the federal cabinet. But I make a very deliberate point of not freelancing into foreign policy. We ask, one of the long-standing demands of Alberta is that the federal government stay out of our backyard in areas of our exclusive constitutional jurisdiction, and I have to reciprocate when it comes to their areas of exclusive jurisdiction, such as foreign policy. I will say this, though, I am concerned to have seen over the weekend a number of disturbing reports about anti-Semitic threats and behavior. There's a report out of Edmonton about an individual who claims that people came to his house, quotes, asking if Jews lived here. And we saw these apparently violent incidents in Toronto. So I find that abhorrent, and I condemn any expression of anti-Semitism in any part of this country, period.
And Andrew, do you have a brief follow-up?
I do, and moving back to COVID, and I don't know if this question is for you, Premier, or for Dr. Hinshaw, but we keep hearing talk about the vaccination rate that we need to see in the community before restrictions are lifted. In a number of American jurisdictions and elsewhere in the world, people who are fully vaccinated have more privileges, if I can say that, when it comes to being exempt from some gathering restrictions. Why not do this in Alberta to incentivize getting fully vaccinated, allowing people who are vaccinated to gather with others who are and engage in some other activities while we are getting up to that point where we have a community-wide herd immunity?
Great question, Andrew. So first of all, I anticipate later this week we'll be announcing potentially a relaxation of self-isolation and quarantine requirements with respect to people based on whether they've had a first or second dose of the vaccine. That will reflect the lower level of threat or the lower level of risk that they pose. And secondly, in terms of the broader population, I'll refer that to Dr. Hinshaw. I'll just say this. Our overall vaccine numbers are now moving so quickly that I think it'd be a lot simpler for us to focus just on overall population immunity. We are cresting past 50% of eligible Albertans being immunized today, tomorrow, and we have 800,000 appointments booked. So we should be at some point in June pushing 70% of the eligible population vaccinated. That's our hope. And if so, that bodes very well for a broad reopening later this summer. And I, in the meantime, if we were to tie specific public health measures to whether you've been vaccinated, like, let's say, wearing a mask, then what happens? Then do employers have to go around and validate whether or not the people who are not wearing masks have been vaccinated? Did they get their first dose? When was it? It creates a huge amount of administrative and enforcement complexity and probably friction and unforeseen problems that we'd rather not get into. We'd rather just focus everybody, team effort, we're all in it together. Everybody who can, please get vaccinated. And if we do that, we think within a matter of weeks, we'll be able substantially to remove public health restrictions. Dr. Hinshaw, would you like to comment?
I would just add that if we were to create different rules for people who were vaccinated and those who were not, it would require the production of some kind of proof of immunity or disclosure of personal health information for the purposes of that activity. And there's been a very clear direction set in this province that that kind of disclosure of personal health information will not be required of Albertans. So again, that policy shift to look at allowing more activity when people are fully vaccinated is going to be something we do as a population and not as individuals, again, because that's only possible with some kind of objective proof to change our current public health orders, and that is not going to be happening in the province.
Operator, could you please put through our final caller?
Final question is Audrey Neveu with Radio Canada. Go ahead, Audrey.
Hi, Premier. Thank you for taking my questions. If you could answer in English and in French as usual, that would be very appreciated. My first question is, I would like to know, can you confirm if the legislature will resume next week as previously mentioned?
Yes, the legislature will resume on Tuesday following the Victoria Day long weekend. Oui, l'Assemblée de la législature de l'Alberta va résumer ses travaux le mardi prochain. Mais les comités de l'Assemblée continuent de faire le travail actuellement.
And a follow-up, Audrey?
Yes, Premier, given the discontent we've seen last week in your party, don't you want to quell it once and for all by moving up the leadership review that you're supposed to undergo in fall 2022, albeit maybe not like in the middle of the third wave, but earlier?
Well, that's a question for the board of the United Conservative Party, which decided, I believe, on a 16-to-1 vote to hold that vote in sometime in 2022. They haven't said the fall or the spring. They haven't identified when the annual general meeting will be. So I'll respect the decision that they make in that respect. And I certainly don't think it would be helpful for the province or the government to be distracted by internal politics like that, particularly during a crisis such as the one we are in. So I'll say that in French. La décision d'un vote sur le leadership de mon parti est vraiment une question pour le parti et ils ont décidé d'avoir un vote en 2022. Ils n'ont pas décidé dans quel mois. Et alors, je suis toujours ouverte à cette occasion de démocratie intérieure du parti, mais je crois que ça serait imprudent d'avoir un tel vote pendant une crise comme l'actuelle.
That concludes our Q&A today. Thank you, everyone.